Next step, we will perform critical appraisal of this evidence using a worksheet for EBM therapy that is already in your guidebook.
Let's start our next exercise, critical appraisal. We use the same article, 3-day versus 5-day treatment with amoxicillin for non-severe pneumonia in young children, a multi-center randomized control trial. Before we do critical appraisal, we should understand study methods, study participants, study intervention, and how the outcome was measured. Which subjects were 2,188 children among 2 to 59 months with cough, rapid respiration, or difficulty in breathing. Criteria for non-severe pneumonia is respiratory rate more than 50 per minute for age 2 to 11 or more than 40 per minute for age 12 to 59 months. Participants will not participate in the study if following criteria has found. The intervention of this study could be seen in this slide. The intervention was oral amoxicillin in 3 divided doses, of whom 1,095 given 3 days and 1,093 given 5 days. Please see this chart to understand how the intervention, amoxicillin or placebo, were given to the participants. The primary outcome of this study was treatment failure. It is mentioned in the article, which you can see in this slide, how the investigator defined the treatment failure. Each participant was followed for 3 days and 5 days after enrollment, and also 12 and 14 days after enrollment. Now, we should determine the PICO of the study, which are: for the patient or problem was non-severe pneumonia in children. Intervention was antibiotic for 3 days. Comparison, antibiotic for 5 days. The outcome is the cure rate or treatment failure. To appraise the article, we have to find out if the study is valid, V. The results are important, I. And if the study applicable, A. In this block, you are able to answer only validity and important of the study. For applicability, you can learn in the next block. Look at your worksheet. First, to assess whether the results of the trial is valid, we should answer the questions number 1A until 3. 1A. Was the assignment of patients to treatments randomized? Yes. The study is randomized controlled trial using block randomization with variable size block to avoid unblinding. The participants will receive 11 doses of amoxicillin for 3 days and 8 doses of amoxicillin or placebo for the next 2 days. 1B. Were the groups similar at the start of the trial? Look at Table 1. The answer is yes. Both groups were similar on characteristic at the start of the treatment, or what we also call baseline characteristic. 2A. Aside from allocated treatment, were the groups treated equally? In this study, we can see from this article, which described in this slide, that both groups were treated equally. So the answer is yes. 2B. Were all patients who entered the trial accounted for? And were they analyzed in the groups to which they were randomized? Yes. You can take a look at the flowchart. This question is related to intention to treat, which has been explained during the control exercise. Loss to follow-up in this study is quite low, no more than 20%. 3. Were patients measured objectives, or were the patients and clinicians kept blind to which treatment was being received? The answer is yes, because the outcome of the study was clearly defined and study was double-blind. And to know if the results are important, we should answer the question number 1, how large was the treatment effect? And 2, how precise was the estimate of treatment effect? What were the results? First, we should know how large the treatment, or we called effect size, was, and how precise the estimation of the treatment effect. To know effect size of the study, we have to calculate the relative risk, or RR. The RR is defined as the incidence rate of the outcome in the treatment group divided by incidence rate of the outcome in the control group. Please see the 2 × 2 table in this slide, how the relative risk is calculated. First, make 2 × 2 tables to calculate the RR from table 2 for primary outcome cure. Please see the table in this slide. Then, we have to calculate EER, or experimental event rate, or the incidence rate of the outcome in the treatment group. The formula is A divided by A plus B. Then, CER, or control event rate, or the incidence rate of the outcome in the control group. The formula is C divided by C per D. Actually, this study has calculated EER and CER. Please see table 2. Then RR is calculated by dividing EER with CER. Please see this slide to know how RR was calculated. Another measure of the size of the treatment effect is ARR, absolute risk reduction, which is calculated by CER minus EER. Please see this slide to know how to calculate the RR. The relative risk reduction is the difference between EER and the CER, or EER minus CER divided by the CER, and usually expressed as a percentage. Please see this slide how to calculate CER. The NNT, or number need to treat, offers a measurement of the impact of medicine or therapy by estimating the number of patients that need to be treated in order to have an impact on one person. The formula is 1 divided by ARR. Please see this slide to know how to calculate NNT. Confidence interval, CI, ARR. The estimate of where the true value of results lies is usually expressed in terms of a 95% CI. You can calculate the CI by this formula. Please see this slide, how to calculate 95% CI from ARR.
Everybody, we already performed our practical work. Thank you for your attention. We hope this will help you to understand how to perform a critical appraisal on evidence of therapy, and we hope the objective of this practical work will be completed. Thank you.